Hello, everybody. My name is Tom Windle. I'm a physical therapist and runner, and I have with me Tom Dotson, who's a runner and one of my clients. Today, we are going over the topic of Achilles tendinopathy. It's a injury that a lot of people have dealt with, especially runners, but also non-runners, and other athletes also deal with Achilles tendinopathy. It can be very burdensome, very frustrating, cause a lot of anxiety when you're dealing with it because it just takes away from participating in running and sport. Uh, so it's something I wanted to talk about because there's a lot of conflicting approaches and exercises and what to do and what not to do. So Tom, why don't you kind of tell them your story of how you dealt with your Achilles and what got you to me?
Yeah, I suffered an Achilles injury in late 2024 following a half marathon that I did. And a friend of mine referred me to Tom, and Tom was very familiar with the injury. He told me exactly what type of corrective exercises to do, and also, probably most importantly, what not to do. Today I'm back to running. I'm probably in the best shape of my life. And Tom Strong Anchor is now part of my running team and will be for the rest of my fitness and running journey.
Yep. Yeah, I think what you said, Tom, was like what not to do is huge. And that's the number one thing I think people make mistakes is they throw the kitchen sink at it, something happens and they get hurt, and it's like, okay, let me Google these exercises, and they don't have like a framework to go off of.
Yeah.
So I have a list here of kind of what Tom and I went through as we were getting Tom better and back to return to running. The first step here was kind of what we were just talking about, was addressing the psychosocial factors. Tom did his research on Dr. Google, had a lot of information already flowing through his mind. He was also, obviously frustrated and just didn't see a path forward, correct?
Correct. Yeah. And I even went to another physical therapist for probably 3 months, and I was just not getting better. So I was starting to get a little bit depressed, very frustrated, and I wasn't making any gains. In fact, I was probably getting worse.
Right, and there was exercises that he was doing that were just painful, and you kind of went into it like, oh, I know this is going to hurt, right? And that's not how you want to approach exercise, with that fear, avoidance, or expectation of pain. So number one was addressing the psychosocial factors. Me and Tom had to get on the same page for seeing the goal, which was pain-free. So once we established that, we had to get to the second phase, which was offload. And when I was talking with Tom, we realized quickly that his pain was way too high for what he was doing. So we had to really offload the injury. And what was your pain level at?
It was probably a 5 or 6.
Yeah, 5 or 6 out of 10, which is too much. And my goal was to get him down to 2 to 3 out of 10. And do you remember, what we did to get there?
I do. I remember that you felt that we were sort of trapped in the acute phase and we really needed to shut it down. So for the next 2 weeks, you said, Tom, I really would like to see you not do any training, and let's offload that. And when you get out of bed in the morning, I'd like to have you take very conservative steps, because I think you said that's when your Achilles is most vulnerable. So I would shuffle as soon as I got out of bed, and I quickly got down to a 2 to 3 in the next 2 weeks.
Yep. I call it the morning shuffle gait, because if you just jump out of bed and walk normal, and if you had Achilles problems, you know what that feels like. Other things that you can do is heel lifts, taping can be supportive. So anything you can throw at it to offload the injury, to get it down to a 2 to 3 is the goal. And we were able to do that. 2 weeks went by. Tom said, hey, I'm doing better. It's now at 2. And that led us to step number 3, which was assessing his load tolerance and load response. With running, the Achilles tendon has to absorb 3 to 8 times our body weight. And when I'm assessing someone's load tolerance with an injury, I like to start below body weight first. I like to start with the safest approach first. So we did low body weight exercises off a leg press. We did seated heel raises. And it wasn't anything crazy, but we had to start somewhere. And so we started with that and then assessed his load response. And do you remember how we went about that phase?
I do. I remember you said that let's try to keep this at a 2 or a 3, and if it does go higher during the exercises, we would reduce the load.
Yep. So we were in really good communication. If the next morning he was back to that 4 after assessing load, we had to reload it again, start at even lower level than what I thought, and repeat that process until we got a good tissue response. So we were able to establish that pretty quickly, which was great, which led us to step 4, which was graded exposure. We had to, in that process, this process can take, several weeks to get. But the graded exposure is starting at that below body weight and progressing to 3 to 8 times body weight. So we slowly ramped up Tom. Each week, Tom, I think the exercises got harder and harder for you.
Yeah.
We upped the load on his single heel raises. We upped the load on his isometrics, and just put that Achilles tendon through more and more load very methodically until we got to that desired range.
Yeah.
And then we were successfully able to do that. And step 5 was our return to run program. And step 5 you can mix in with step 4. As runners, and we have to kind of offload that running, it's important to integrate running specific exercises so that when you get back to running, all of your tissues are ready and able to handle the running forces. So we did a really good return to run program. Tom was on top of his strengthening. We started a walk-run program, and we were really in great communication with that process. And that went really well. And then this last phase is a really important phase. This is the phase that I'm still in as someone who's dealt with this. Tom is still in this phase. And any runner who deals with tendinopathy, it's very important to maintain that tendon loading capacity. So I'm hoping, Tom, you're still doing your exercises?
Still doing them.
Okay,
yeah.
Good. And it's nothing crazy. It's 2 to 3 exercises, 2 to 3 times a week as he's ramping up his running, his exercise, his tempo running. It's just not ignoring. It never is something you just want to ignore and put back on the shelf. So yes, that covers our whiteboard topic. Obviously, there's a lot more that can go into it. And the cool thing is this tendinopathy applies to a lot of different tendinopathies. Patellar tendinopathy, hamstring tendinopathy, gluteal, golfer's elbow, tennis elbow, rotator cuff. So if you're dealing with a tendon issue, physical therapy is a great resource to use. Be careful with Dr. Google, and don't hesitate to reach out to me at Strong Anchor Physical Therapy. Thank you, Tom, for your time.
Thank you.
Appreciate it.
Thank you.
And if there's a whiteboard topic that you want to go over in the future, let me know and we'll cover it.